Hello guys, welcome back to the video. In this video we're going to talk about on shoulder joint. Shoulder joint is a weak type of joint. It is a ball and socket type of synovial joint. It is between two bones. One is the head of the humerus and the glenoid cavity of scapula. That's why it's also called glenohumeral articulation. Uh, I told about the weak joint. It is because the glenoid cavity is too small and shallow, so it can't hold the humerus hand tightly. So it can display the head of the humerus can displace and uh, can cause the dislocation of the shoulder joint. First, this is the weak type. This is the ball and socket type of synovial joint. You have to write in this manner. First, the introduction part, just ball and socket type of synovial joint, weak joint. You have weak joint. Why it is weak joint? You have to mention because of the small part, the shallow and the small in the size of the glenoid cavity. So the humerus cannot fit into that, so it can dislocate. You have to don't mention the dislocation, but you can have the pretty much idea. Then you have to go to the other name I told about, the glenohumeral articulation. Okay, it and it is between the head of the humerus and the glenoid cavity of the scapula. Then there is a factors which is mandatory, which is maintaining the stability of the shoulder joint. Let me write those. This is the important thing you have to mention. First, introduction part, intro. You have to write this order. First, you have to ball and socket, weak joint, and it is between the head and the glenoid cavity, so that's the humeral glenoid. You have to write that order. Then go for the factors affecting the shoulder joint, or factor maintaining the shoulder stability of shoulder joint. First factor of the series is secondary socket for the humerus of the head of the humerus. The coracoacromial arch, or the secondary socket, it maintaining the stability of the humerus, head of the humerus, so it can't displace upwards. Then there is a musculocutaneous cuff, or the muscle. This is the secondary socket, which is this, the coracoacromial arch. This is the coracoid process and the acromion. This is the acromion. There is an arch which stabilizes the upward displacement of the shoulder joint. Then the musculocutaneous cuff, or the muscle around the shoulder, we stabilize the movement and or stabilize the joint from displacement. Then don't worry, I gonna talk about the muscle in detail in next order. So third is the glenoid labrum. You can say it is a lip which help for deepening the head of the humerus. You have to imagine this is the This is the glenoidal labrum. The head of the humerus attached to it, so it can't. It tightly attach the head of the humerus, so it give a stability to it. Then it is also the muscle attached. The muscle, which muscle? The pectoralis minor, major, the surrounding the posterior one, the posterior muscles. This also there is the fifth factor is atmospheric pressure, ATM, which also stabilize the joint. This is a muscle around the joint. Then the secondary socket, the muscle around the joint, and the glenoidal labrum. Then the muscle of anterior and posterior one, anterior one and the posterior one, and also atmospheric pressure. This all the things stabilize the shoulder joint. Then there is a ligament. You have to know the name of the all ligament. So first, in every shoulder, every joint, you have to mention the scapular joint of ligament. This scapular ligament is mandatory for all the joint. Then the other joint you have to mention. The first is capsular joint. Then the coracohumeral ligament. I will show the picture of all the things, don't worry. Then the transverse humeral ligament. Then fourth, the glenoidal labrum. It is also act as a ligament. Okay. This is the glenoidal labrum is a fibrocartilage rim which covered the glenoid cavity. Okay. Then there is bursa. The name and all the details is in your book. Please read the book after watching my video. Then bursa. The bursa is subacromial or subdeltoid bursa. Then subscapularis. Then infrascapularis. Infrascapularis, not spinatus. Infraspinatus. Okay. Hello guys, this is the picture of the shoulder joint. This is the parasagittal section of the shoulder joint. So let me put the direction: superior, inferior, anterior, and the posterior. This is the medial and this is the lateral. So this is the all the things. So first you can first the thing this is the glenoidal labrum. Okay, this is a glenoidal cavity. I gonna write the abbreviated name of the short form of the name. This is the glenoidal cavity, glenoidal labrum. This you can see this ligament. This is the ligament. This is not a ligament. This is the tendon. This is the long head of bicep brachii. Okay, long head. This is the intracapsular origin. The long head of bicep brachii has an intracapsular origin. Next, this is the coracoacromial ligament. You can, this is the, what is this? What is this? This is the coronoid process, and this is the acromion. Okay, this is the coracoacromial ligament. The this one, this is the subacromial bursa. Subacromial bursa, because it is behind, it below, or it covered, it is covered by the acromion process, so it can called the subacromial bursa. Okay, then this one, the muscle, this muscle is subscapularis. Okay, so what is the name of this bursa? You can see, this is the bursa, and this muscle is called the subscapularis. So what is the name of this bursa? Subscapularis bursa. Okay, the anterior of the subscapularis is this muscle. This is the short arm of bicep brachii. Okay, and anterior most is the deltoid. Okay, this bursa is also called the subdeltoid because of the deltoid is anterior most, subdeltoid or subscapularis. Then this muscle, this is the supraspinatus, this is the infraspinatus, this is teres minor, and this is the long head of tricep brachii. Okay, and this is the teres minor, this is the infraspinatus, supraspinatus, and this is the and this is the this. Okay, that's covered. Okay. This is this thing. Oh, then this is two artery and a nerve. This is this artery called posterior circumflex. You can got me this, and the nerve is the, which muscle is this? Tricep brachii. So what nerve going to not supply, which nerve going to cross the humerus, or there is one nerve, and this is the one nerve. The uppermost nerve is axillary nerve. This is the radial nerve, this is the ulnar nerve. Okay, the radial nerve going to be behind the radial group of the spinal group of the humerus, and the surgical neck, in the surgical neck the axillary nerve going to pass, and the lateral epicondyle, the ulnar nerve going to pass. Okay, this is the surgical neck. Okay, okay, this is all the things. Oh, this is the synovial membrane. Okay, or synovial membrane, and this is the synovial capsule. This is the, okay, abdomen, all the things dealt with. This is the pretty much thing you have to know. In next video we're gonna talk about the movement of the shoulder joint and the clinical features of this. Okay, and in this in that video we're gonna talk about the all the movement and the muscle involved and the ligament involved in this movement. So please watch this video, then go to the next video. Okay.